Hello everyone, you are from Group 5. We'll be presenting to you about galactosemia. Galactosemia is an inborn metabolic disorder caused by a gene mutation impairing the body's ability to convert galactose into glucose via the cellular pathway due to enzyme deficiency. It is classified into several types, and today we will focus on type 1. Although galactosemic babies can't drink lactose-containing milk, galactosemia differs from lactose intolerance. Since galactose is a part of lactose, that is why they need lactose-free milk.
Let's begin with the etiology of the disease. Galactosemia is caused by gene mutation that codes for the GALT enzymes. It is an inherited autosomal recessive disorder. A child needs to inherit 2 copies of the defective genes, one from each parent, in order to have the disease. A recessive gene will only be expressed if the genotype is homozygous. In order to inherit the disease, each parent needs to have at least 1 defective gene. The child will have 50% chance to inherit the defective gene and 25% chance to develop the condition by inheriting 2 copies of the defective gene from each carrier parents. To add, the condition is commonly first detected after the heel prick test that was performed 72 hours after birth as part of standard newborn screening. Classic galactosemia occurs when the liver enzyme called galactose 1-phosphate uridyl transferase is missing or not functional. This enzyme is responsible for breaking down galactose into glucose. When galactose cannot be changed to glucose, galactose, as well as its other byproducts such as galactose 1-phosphate, builds up in tissues and blood and affects many parts of the body.
Ultimately, levels of galactose 1-phosphate reach toxic levels, and galactose may be alternatively reduced to its sugar alcohol form, which is galactitol. Galactitol is thought to cause direct damage to tissues, leading to many adverse effects. Even with treatment at young age, effects such as primary ovarian insufficiency or failure may occur in most girls. Galactosemic baby may show early signs and symptoms such as vomiting excessively, loose appetite, diarrhea, and lethargy. If untreated, the baby may develop jaundice such as yellowing of the skin and white eye, extreme weight loss, and risk to organ failure.
So how do you diagnose a child with classic galactosemia? Diagnostic tests are classified into 3 categories. First, GALT assay, second, metabolite assays, and third, molecular testing. In GALT assay, doctors will request a whole blood sample to measure erythrocyte GALT enzyme activity. A reduced GALT activity of less than or equals to 3% is usually diagnostic of classic galactosemia, and this test is also considered the gold standard. In metabolite assays, doctors will request either a whole blood sample to measure erythrocyte galactose 1-phosphate concentration or a urine sample to measure galactitol. In galactosemic patients, the results for both tests are markedly elevated. Finally, in molecular testing, a whole blood sample is used for mutational analysis of the GALT gene. This test is useful in confirming the diagnosis and should be correlated with biochemical results. For us dietitians, it is crucial to do a complete nutritional assessment on the child once they have been diagnosed. There are 4 different components to focus on. A is for anthropometric measurements. Height and weight should be monitored to ensure their growth is within normal range, and WHO children growth charts are used to assess trends over time. B is for biochemical measurements. Galactose 1-phosphate levels should be routinely monitored to assess therapy response and dietary compliance. Next, liver function tests to check for signs of liver damage due to previous exposure to galactose. C is for clinical signs. We have to check for symptoms of galactose intolerance and history of complications such as cataracts. Lastly, D is for dietary intake. Here, we ask open-ended questions related to their daily dietary habits. For example, 24-hour diet recall is conducted to assess for galactose-containing foods in the diet such as dairy products. Evaluate macronutrients and micronutrients such as protein, calcium, and other nutrients potentially lacking due to dietary restrictions.
There are 2 types of medical management for galactosemia, which are GALT activity restoration and by influencing the pathway of events. GALT activity restoration can be done via gene therapy. For in vivo, DNA that contain desired genetic material will be introduced into the cell by the use of vectors, usually adeno-associated virus AAV for classic galactosemia. The cells then able to produce GALT enzyme for the body. Next is by performing mRNA therapy. In this therapy, mRNA will be introduced into a cell, recognized by ribosome for translation, allowing GALT enzyme to be produced. Pharmacological chaperones is a small molecules that helps facilitate intracellular folding and trafficking. In classic galactosemia, arginine supplementation may have a therapeutic effects due to its property as aggregation inhibitor. Galactosemia also can be managed medically by influencing the pathway of events. First is galactokinase 1 inhibitor, which it reduces the galactose 1 phosphate accumulation in classic galactosemia. Next is aldose reductase inhibitor. The aim is to block NADPH-dependent aldose reductase conversion of galactose to galactitol, causing accumulation in cells, which then lead to cell apoptosis. Lastly is endoplasmic reticulum stress reducer. It helps reduce the accumulation of misfolded protein in endoplasmic reticulum, which usually occur due to altered signaling pathway.
Next, we look at the lifestyle management of galactosemia. The first one is regular checkup. Routine medical evaluations are essential to monitor growth, development, and any potential complications associated with galactosemia. These include regular blood tests to check for galactose levels and assessing developmental milestones to identify any delays early on. Next, psychosocial support. Emotional challenges like anxiety or frustration from dietary restrictions are common, so psychological support or counseling can help. Moreover, educate family members about the condition to create a supportive home environment. Families may benefit from counseling and training to navigate dietary restrictions effectively and support their child's mental and physical well-being. In addition, connect with organizations like the Galactosemia Foundation for peer support and resources. For diet and social adaptation, the first one is work with metabolic dietitian to plan meals that meet nutritional needs without galactose-containing ingredient. The next one is be cautious when eating out or ordering takeaways. Inquire about ingredients to avoid hidden sources of galactose. And the last one is carry safe snacks or meals when traveling to ensure dietary compliance.
Move on to the last part is diet suggestion for galactosemia. The primary treatment for galactosemia is a strict lactose restricted diet which eliminates all sources of lactose including dairy products. For example, lactose-free milk substitute and other non-dairy foods are recommended. Here's some of the safe food options which include non-dairy milks, whole grains, fruits and vegetables, protein and healthy fat. Individuals with galactosemia should avoid obvious sources of lactose and galactose, for example, milk, butter, cheese, and yogurt. Also, avoid the food with less obvious sources of lactose and galactose, for example, milk chocolate, biscuits, soys, and processed meat. This is some of the substitute options that people with galactosemia can do. Next, we go to the diet tips for managing galactosemia in local setting. Firstly, understand local food availability. Familiarize yourself with grocery stores that offer lactose-free and dairy-free products. Also, explore local farmer markets for fresh fruits and vegetables. Next is label reading. Always read label carefully to identify any hidden sources of lactose. Be aware with food labeling, which may help in identifying safe products. Besides, people with galactosemia also can cook at home. Prepare meals at home to control ingredients and avoid hidden sources of lactose. Experiment with local recipes that can be modified to be lactose-free. Next is meal planning. Create a weekly menu that incorporates safe food and allows for experimentation with new recipes. And plan meals ahead of time to ensure a balanced diet while avoiding galactose. Another tip that people with galactosemia can do is when dining out, ask restaurant staff about ingredients and preparation method to ensure meals are safe. Also, look for restaurants that offer vegan or dairy-free options. Lastly, they also can join community support. Join local support groups or online communities for families managing galactosemia. They can attend workshops or seminars on dietary management of galactosemia.
That's all from us. Thank you for watching.